Just now, I present what we have learned from the first week. And I also prepared some open questions. We can have some online discussion on it. Please go to Socrative.com and click on Student Login. In the text box for the room number, input 194 FAABA. That is the code for this room. If you enter the room, there are 2 questions. Ask for your short answers. Please post your answers before Thursday, February 12th. On Thursday, I will open this room and to collect your answers. And then I will summarize the feedback and publish in the next lecture for the further discussion. We use this way to trigger some in-class discussion. And now let's talk about the new concept, evidence-based practice. We already know evidence-based intervention, how we can design it in our education practice. But how such kind of evidence-based practice can be directly applied in our daily work? I think you may have the impression when you go to the school, you were given the textbooks and you were told that you need to teach these textbooks. And you may be wondering, why this textbook? Why not the others? Or the colleagues may tell you that you need to use this way to teach this and that. And maybe you will ask, why not use another way to teach it? And they may say, well, it's just because the other teachers did the same. Or it's just because when I came here several years ago, people already did that. Like what's in this image, it shows. We don't want to be the one to break the traditions. But we are also not confident whether the traditions in education practices are really evidence-based practice. So we do have the evidence to prove that this is an effective tradition. No, most of the practices in education, daily work, we don't have the evidence. So that is the problem. Back to our discussion of the medicine research. In the medicine research, from very long time ago, they already proposed the most reliable evidence comes from randomized controlled trials. Like in lecture 1, we have discussed. The same in education practice. This evidence-based practice comes from evidence-based medicine. Actually, this notion is not new. Early in 900s, people already mentioned that if we want to use some medicine, we need to first test the effect of this drug on human and not on animals only. And then we can prove this medicine is effective and then use it for other patients. And evidence-based practice is a linear and a rational approach to decision-making based on quantified data, aiming at establishing practices on scientific basis. If I interpret this definition, I may think in a school, if the school director wants to invest on certain facilities, because this one may help the pupils to learn better, or if the school director wants to adopt a new instructional methods and ask the teachers to use it. And we may think, hey, such kind of decision, do you have any data to support you? Do you have any data to support this is an effective way to do that? I still remember that in our school at Hansa, in our business school, we invest a lot on different kinds of education setups or some kind of technologies. We try to strengthen students' communication, online communications. But we don't have any evidence. So after a few years, well, it's just abandoned because we don't have quantified data to support this is a right decision. So for such kind of decision, it's just waste of money or waste of time. So for evidence-based practice means if we want to make a decision in education practice, we'd better make the decision based on quantified, let's say, hard evidence. And the practice needs to be established based on scientific basis. So all this notion comes from evidence-based medicine, early 1990s. And this kind of notion strongly influenced the other subjects, such as social work, education, pedagogy, research, etc. In contrast to evidence-based practice, we also have practice-based evidence, PBM. And what is PBM? Let's look at these three circles. First is the clinical omstandigheden, the conditions, the status quo, and the patient's conditions and behaviors, and the most, let's say, the best available scientific evidence. And when all these are connected together, when they mingle together, that is the clinical expertise. I don't know whether you have this kind of thinking. If I go to the hospital, I visit doctors, I do expect that the doctor who is going to diagnose me is an old doctor, is someone who do have some age, who is not very young. I still remember when before I delivered my baby, I went to the hospital, and the doctor who talked with me is a very young male doctor. I think maybe his age is only early 30s. Well, after the talk, I'm quite doubt whether his suggestions is correct or not. And the next time I visited the hospital, I said, can I change the doctor to find a more experienced one? And then another doctor who is going to get retired talked to me. Actually, I'm not quite sure which one is correct, but just according to my impression that the old doctor may have more expertise, may have more experience. So sometimes the evidence comes from their experience, the experience coming from the practice. So this is a practice-based evidence. Here, I would like to show you a research paper conducted by Professor Fischer from University of Groningen. And this research project is opbrengstgerichte werk, literally translated in English, is kind of performance-related, performance-oriented, or yield-oriented work. This is a specific Dutch term that in 2007, the OCW the Dutch government has introduced it because they want to prepare potential, let's say, lagging behind of the Dutch kids in some key subjects like mathematics and reading. And all this evidence that the Dutch kids tend to lagging behind comes from the international comparative research, such as TIMSS and PISA. And in Professor Fischer's project, in this report, we can see there are some kinds of data, some evidence has been established from this international research. So first is in this performance-oriented work, we need to have a systematic, conscious, and cyclic work. And the aim is to maximize the academic performance of the kids. And this means that all the teachers and the schools need to work as a team in a structured way to achieve these goals one by one. And they also collect the data, but collecting the data is not the ultimate goal of this project. Collecting the data is working as a step of this working process, and we need to reflect on the data analysis to see how we can improve in the next stage, and what kind of teachers' actions are favored in order to achieve the goal. And here I present the screenshots of the reports. Actually, this is a bit old information now from the teams and from the PISA. And the teams represent trends in international mathematics and science study. So in the teams research, they look at mathematics and science. These are two knowledge expertise. And for the PISA study, they look at mathematics, reading, and science. And now I have a new data for that. From the old data, we may find that in 2007, that the Dutch kids, their mathematics, the rekenen and wiskunde, their skills touch the bottom here. And let's look at the newest data. This is the data published in 2019. And in this data, to our surprise, in 2015, it's even lower grade than 2007. So the mathematics skills really touched the bottom in 2015. And the green one is for the science. So also in 2015, the science part is not very satisfying. But in 2019, that's the newest data, we can see for the mathematics, it has been improved. While for the science, the improvement is not very obvious. So this is the newest data. This evidence comes from a large international comparative research, TIMSS. And the other one is PISA study. And PISA study is organized by OECD. It represents Program for International Student Assessment. And this one focuses on 15-year-old 15-year-old kids, their abilities of reading and mathematics and science. If I zoom in this international list, where is the Netherlands? And we can find it's here. It's here. And the first one is for reading. This is for the reading. And in Europe, the top one country is Estonia. And the second one in Europe is Finland. And for mathematics, we can look at that one by one. So this is a reading. If we check it, this is the Netherlands. And in Europe, the top one country is here, Estonia. The second one is Finland. And the Netherlands is here. And look at the other one, mathematics. In 2019, as I said, the mathematics skills has been improved in the Netherlands. And in Europe, again, the top one is Estonia. And the second one is the Netherlands. And the Finland drops here. Yeah? So for mathematics education in 2019, we can see a significant improvement. While top of that, internationally, are always the East Asian countries. The East Asian countries here. Okay, and then take a look at the science. Here is where Netherlands is located. And again, on the top are the East Asian countries. And Estonia is again the number one in Europe. Finland is the number 2 in Europe regarding to science. This kind of international comparative study provides us evidence that we expect in the Netherlands, 1.3 million of the Dutch are low literate, and actually 65% of them are the natives. You can find this from Professor Fisher's reports. And use such kind of evidence, how can we improve our education? And it says, using evidence of achievement, we can adapt what happens in classrooms to meet learner needs. So internationally, we know what is the status of the Netherlands, and we know what kind of goals we need to set up for our pupils. And we need to maximize the performance of all the pupils. So here they present the working methods of that. And it's very systematic, linear method. And you can see it is working as a team. So the school and also the bestuur niveau, so the management team and also the group, this work as a structured team. And the first step is to analyze and evaluate the results and set up strategic and also challenging learning goals. And for these learning goals, decide what would be the strategies, learning strategy, teaching strategy, management strategy in order to achieve the goal step by step. And after that, is implement this strategy to achieve the goal, and then to achieve higher learning performance. So step by step, a linear process for this evidence-based practice. And in the report, Professor Fisher also provides some recommendations. And very interesting recommendations is this one. Unveiling 2, only evidence-based professionalization for this project. So only evidence-based professionalization. We know that in the Netherlands, the basisschool every year invest a lot of money to make the leerkracht, the teaching staff, more professional. So they receive a lot of professionalization training. And some training are effective, or some training are not effective. So the suggestion here is, what kind of a training program is effective? We need an evidence to see it. And we need to see the intervention to demonstrate the causal-effect relationship. That this one is effective is just because of this training. It's not because of other reasons. So some intervention are favored. Intervention research are favored. In 2017, I went to Finland. And in 2019, I went to Estonia to visit the schools and also their teacher education, the conference, how they achieved very satisfying performance in the country, especially like the teams and the PISA shows. What impressed me is, in both countries, the basisschool, the primary school teachers' professionalization is very high. I heard from the conference that in Finland, without a master degree, you are not allowed to be the basisschool teacher. So such kind of high qualification makes enhance the achievement of the students, of the pupils in the primary school. So professionalization program can really bring the pupils' achievement to a higher level. But there are so many such kind of programs. So according to Professor Fisher, we need to have an evidence to find out what is the most effective intervention, the most effective trajectory, the route for that, which program is more effective than the others. So this is what we discuss about evidence-based practice. So you can see researchers have done a lot in order to make the practice generate more satisfying outcomes. However, in reality, there always exist some gaps between research and practices. In the next chapter, in the next part of the videos, I'm going to discuss what kind of gap exists between research and practice, and how can we minimize this gap.